Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle. Wherever you are and however you might be listening to me today, thank you so much for taking the time. This is episode 215 of the Everything Medicare Podcast, where every single week, me and my company, Christian Brindle Insurance Services, bring you a podcast episode on Mondays where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Folks, if you're not familiar with me, my name is Christian Brindle. I published 3 books about insurance, 2 specifically about Medicare. My company works with people in 10 states on Medicare specifically, whether it be Medicare supplements, Medicare Advantage plans. And we are closing in on the Medicare Open Enrollment period this coming fall. Medicare Open Enrollment takes place from October 15th through December 7th, each and every year. And it's important that, in my opinion, especially if this is your first time experiencing open enrollment, that you know a couple of things to kind of prepare you, because it can be very intense and kind of stressful if you don't know these things for you, the consumer. And I really do believe that. I think that one thing you got to keep in mind about Medicare open enrollment is every single person wants to be your best friend. Right? From the insurance companies, some you've heard of, some maybe you haven't heard of, to every single insurance agent that might be in your market, and maybe quite a few that might not even be in your market, they all want to be your best friend. They want to hold your hand, they want to wrap their arms around you, and they want to say that they have your best interests in mind. Although, truth be told, only a small amount of them really do. And one thing, in my opinion, that is incredibly important to keep in mind is, for most people on Medicare, whether it be Medicare Advantage plans or Medicare Part D prescription drug plans, and most people have one of those 2 kind of programs that are on Medicare, 99% I would say, because if you have a Medicare supplement plan, the Medicare drug coverage is not included with that. And so you have to pick up the drug coverage separately, or you can go to the Medicare Advantage plan. Those are really the only 2 ways you can go with your Medicare, unless you have some kind of retirement program or some kind of rare situation like that. But for the most part, people are impacted by these changes. What happens is every single year, Medicare Advantage plans and Medicare Part D prescription drug plans tweak their benefits. Sometimes they get better, sometimes they get worse. With Medicare Advantage plans specifically, there are a lot of changes that can impact you. There's a lot of working parts that you need to keep in mind when it comes to Medicare Advantage plans. What I mean by this is Medicare Advantage plans make up a lot of areas and variables. For example, they all have networks of hospitals and doctors that they kind of require that you stay in network. So because of this, some plans have great big networks, some plans have itsy bitsy tiny networks. The networks can change during open enrollment. Their prescription drug plan coverage can change. Their formularies that kind of dictate which prescriptions they're going to cover well, which ones they're not going to cover well, and which ones they're even going to cover at all can change during open enrollment. Medicare Advantage plans have health benefits that typically look like copays, like $5 to $10, for example, to see a primary care physician, $30 to $40 to see a specialist, maybe $200 to $300 per night in the hospital for the first 5 or 6 nights. After that, they pay everything for an unlimited amount of nights. Those copays can go up and down. The max out-of-pockets can change. How much dental, vision, hearing coverage they're providing you can change. It is a never-ending cycle from year to year. And you need to know what these changes are. But because these changes are going on, every insurance company that's ever existed in the Medicare industry, along with every single insurance broker, understands that you have a small window during open enrollment to be able to actually make changes on these plans. It's a window where they can basically earn your business. This time period goes from October 15th through December 7th. Year in and year out. So basically what they do is they portion a large amount of their funding into this 2-month window, if you will. And so typically, people on Medicare are bombarded by TV commercials, mailers, phone calls, social media advertisements, internet advertisements, events taking place in your area. You name it, it will happen in an area near you. And it can be overwhelming for people on Medicare. It can be confusing. You might be coerced into thinking that your plan is going down the toilet and there's something that's 10 times better and you only have a certain amount of time to change to this new plan or else you're left out in the cold. But it is important to know that if you're on a good plan, the advertisers don't know that. And they're just trying to get people to contact them. And the best way to get people to contact them is typically by being shocking. You could be on the best plan for you, and you could be coerced into switching to a worse plan just because they want you to. These are things that you need to know. These are the things that you need to be aware of. I have to take a quick break here from this week's sponsor. Pay the bills a little bit. Don't go anywhere, folks. We will be right back, and I'll tell you exactly everything you need to know and kind of what you need to be prepared for this coming open season, because I think it's going to be different than anyone we've ever had before. Don't go anywhere. We'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. We're back with our segment 2 of 2 on episode 215 of the Everything Medicare Podcast. And talking about open enrollment. It's close by. What do you need to know? What do you need to be prepared for? We're going to talk about it today. The benefits in terms of what your plan will look like in 2021 will be announced to the public starting October 1st, but you can't change your plan until October 15th. So there's a little bit of a 2-week window there where you might have time to study your benefits, think about your benefits, before you actually are able to kind of make a transition. That being said, if you're already on a Medicare Advantage plan, expect to get something called an ANOC in the mail. An ANOC stands for an Annual Notice of Change. You will get that middle of September usually, if not towards the end of September. And this will basically outline exactly what is changing on your plan from 2020 to 2021. So you should be knowledgeable on if your plan is changing for the worse. And if you like your plan and it's changing for the better, or maybe it's not changing at all, it's probably nothing to be alarmed about. Is it a good idea to check your plan and see if there's anything better for the upcoming season? Yes, it is a good idea, especially if you have a Medicare Advantage plan, because there's so many variables in play in terms of what could be changing. The ANOC is not going to talk about if your doctor's coming out of the network, or it's not going to talk about if there's been a massive change that can affect your prescription drug coverage. It'll talk about typically the medical benefits, the prescription, the dental vision hearing benefits, things like that. So there's other things you need to be aware of, certainly, but you can at least have some idea of what you're looking at going in. Take some time, go through that ANOC when you do get it. We typically will start communicating to our clients and our customers starting October 1st on what the changes are going to look like going into 2021. Be aware, you're going to be hammered by advertisement. You're going to be hounded like you've never been hounded before if this is your first open enrollment period. By any method you can possibly think of, emails, social media, internet, television advertisements, mailers, people calling you. You might even have some people showing up at your doorstep wanting to talk to you about your Medicare plan. My advice would be 3 simple things. Number 1, if you're going to change your plan, pick a broker that has a history that you can trust, someone that is independent, meaning that they can offer you all of the different options available in your market, or at least a majority of them, so that way they can show you, they can sort through the options, find you your best available benefit. Never, ever, ever sign up with what we call in the industry a captive broker or agent. Reason being, they can only offer you one company. Captive means they work for an insurance company. So they aren't either going to know what the competition has to offer, or they're not going to tell you about it if they do know, because they have quotas to hit. Their job is to sell you a plan for that particular company, whether it's good for you or not. So work with someone that can offer you multiple options. That would be my number one. And make sure they're going to be in it for the long haul for you. Number two, if someone comes in and it's clear they have a bias towards one particular plan, it could be that they have a bigger what's known as contract with that plan. Maybe they might make more money if you buy that plan. Make sure that you're asking questions and don't just completely take their word for it, especially if you don't know this person. Make them earn your business a little bit. Make sure that you trust them. Make sure you believe in them. And make sure it's clear to you that their interest is in what's best serves you, not what best serves their pocket. That's number two. Number three, don't be pushed into changing a plan that you like, especially for a worse one. A lot of car salesmen out there, snake oil salesmen we'll call them. Make sure you're doing something that benefits you, that upgrades your situation, upgrades your potential plan, not downgrades. As long as you stick to those three things, I think you're going to be okay. But don't buy into the hype that everything's going to hell in a handbasket. Could your plan be changing for the worse? Yes. But could it be getting better? Or maybe it's still the best plan for you going into the next year? That could be the case as well. Despite what the Joe Namaths of the world want to tell you, or the Mike Ditkas, or whoever else you'll see on these TV commercials. As always, folks, if you'd like to talk to my company this coming up in enrollment period, we work with people in 10 states. Those 10 states are Utah, Idaho, Colorado, Washington, Oregon, California, Texas, Virginia, South Carolina, and Florida. Again, that's Utah, Idaho, Colorado, Washington, Oregon, California, Texas, South Carolina, Virginia, and Florida. Our office number is 801-255-5340, 801-255-5340. We would love the opportunity to talk with you. Ask for me, ask for Christian, and we'll take a look at your situation. No cost, no obligation, and we'll see if there is a better option for you going into next year. Have a wonderful open enrollment period. We're going to talk about this a lot more as it gets closer, but I thought it was proper timing to have a conversation about it now. Thanks so much for taking the time to listen, and we'll be back with you next Monday with another episode. Have a great week. Take care.